Lynparza is a targeted cancer medicine used to treat specific types of ovarian cancer, breast cancer, fallopian tube cancer, pancreatic cancer, prostate cancer, and peritoneal cancer. Lynparza olaparib is a tablet that is usually taken twice daily, with or without food. How does Lynparza work? PRP is a protein that helps damaged cells to repair themselves, including some cancer cells. If the cells are not repaired, then the cells die. Some cancer cells rely on PRP to repair their DNA so they can continue dividing. Lynparza is from a group of medicines called PRP inhibitors. Lynparza works by blocking PRP, which means the cancer cells are not longer able to repair themselves and so die. How to use? Treatment with Lynparza should be initiated and supervised by a physician experienced in the use of anti-cancer medicinal products. The dose is usually 300 mg orally 2 times a day. The dose may be changed by a doctor due to renal impairment or other factors. Lynparza is able in 150 mg and 100 mg tablets. Contraindications. You should not use Lynparza if you are allergic to olaparib. To make sure Lynparza is safe for you, tell a doctor if you have ever had lung disease, brain problems, or kidney disease. Warnings. Lynparza affects your immune system. You may get infections more easily, even serious or fatal infections. Call a doctor if you have a fever, weakness, tiredness, trouble breathing, usually bruising or bleeding, blood in your urine or stools, or weight loss. You will need weekly or monthly blood tests, and your cancer treatment may be delayed based on the results. Some people who take olaparib with a gonadotropin-releasing hormone medicine may develop a blood clot in the leg or in the lung. Call a doctor if you have pain or swelling in your arm or leg, shortness of breath, chest pain, rapid breathing, or fast heartbeats. Lynparza may cause serious lung problems. Call a doctor if you have chest pain, wheezing, trouble breathing, or in your or within cough. Grapefruit and seville oranges may interact with olaparib and lead to unwanted side effects. Avoid consuming grapefruit products and orange marmalades. Lynparza side effects. Get emergency medical help if you have signs of an allergic reaction to Lynparza, hives, difficulty breathing, swelling of your face, lips, tongue, or throat. You may get infections more easily, even serious or fatal infections. Call doctor right away if you have signs of infections such as fever, chills, weakness, feeling lightheaded or very tired, mouth sores, skin sores, easy bruising, unusual bleeding, pain or burning when you urinate, blood in your urine or stools, pale skin, cold hands and feet, weight loss, or cough, wheezing, shortness of breath. Your cancer treatments may be delayed if you have certain side effects.